Okay. 6:30, I think we can start. I'm Andy Tanger, I'm the town moderator, and I'm just lending a hand with the meeting tonight. And going across the head table, we have Caitlin, and we have Diana, and Mark, and Stephanie, and Brendan. Okay. So, we'll have a Pledge of Allegiance, and then we'll begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Before we start, maybe I'd ask Stephanie and Mark to say what their positions are in Ludlow, so people know why you're up here.
Hi, my name is Stephanie, and I am the chief of the ambulance service in Ludlow. I've been with Ludlow for about 10 years, and in this capacity for about the last 5, I would say.
Brendan McNamara, municipal manager for the town of Ludlow. I've been with the town for about 7 months right now.
Okay, number 2 on the agenda, I think that's your town business, Mark?
Yep. It's for the road salt contract. We have an existing contract with Barrett for our road salt, and it's to the tune of $86.50 per ton, and that is because we have an existing contract. The state is no longer supplying or letting towns buy off their purchasing, so with that, I'm going to make a motion to accept Barrett's contract for our road salt at $86.50 a ton. Do I have a second?
I second.
The ayes?
Aye.
Aye.
The next item on the agenda is the Mount Holly Emergency Medical Services Community Meeting, and it's an update regarding the dissolution of Mount Holly Volunteer Rescue Service. Now, to start off on this, I don't know if it's something that Mark would like to address first.
Okay, we just got an updated letter from the Mount Holly Rescue telling us the equipment and supplies, including the ambulance, will be left in the building for the town of Mount Holly. They want to turn the keys over November 1st at 8:30. And all other facilities from the heat, the water, the electric, and everything else will be turned over to the town at that point in time. And they will make the last receivable and payable close at the end of the year with a final cashier's check of everything that is remaining. So as of the 31st of this month, Mount Holly Rescue is going to be dissolved, and we're going to be looking for support in coverage from Ludlow Ambulance Service. I know they had sent a contract out originally, but we'll do an updated one prior to signing it. And prior to us signing it and agreeing to anything, I want our fire service to look at the contract and make sure everything works for them as well.
So next, would it make sense to have any discussion from the people at the head table with regard to specifics of the contract? We're also going to have the floor open for discussion and questions and comments. For the comments and questions, what we will do is we will let you ask a question, for example, if you have one, and then a follow-up based on the answer that you receive, and then we'll move on to someone else. If there's enough time, we will come back to you, so you're not cut off at one thing. If there is discussion, we'll look to alternate between pros and cons. We want to keep things moving, we want to keep things civil, and we don't want to be here longer than we need to. So hopefully that seems fair to everyone, because that's what we want to do, is we want to strive for fairness, to give everybody an opportunity to be heard. So what's your pleasure, Mark? Do you want to say anything more about this?
I'm just going to touch the highlights of the original contract that we had. There will be some probably revisions to this. This one was to cover the calendar year for the remainder of 23, year 24, 25, and 26. The fees for the service at that point in time were $72 per 911 address, with a total of 1,229 addresses to the tune of $88,488 for the base. So with that, is there any conversations or questions that you would want to bring forth to Stephanie and Brendan?
If you have any comments, what I'd ask, let me recognize you, and then we have a microphone in the front. If you could step up to the microphone and state your name, please, for the record. Any discussion to lead things off? Yes, the microphone's there. Thank you.
This is Amy Turco. Just wondering, is that going to be prorated, or is that from November to December?
Our fiscal year is run on our fiscal year ends the 30th of June. So it can be, depending on the pleasure of the board, and we've discussed things, that it could be prorated if that's where the road we want to go down. I don't have a problem with that. It could be November to November, as long as we and then we'd renew the contract at that point. It's really what the pleasure of the board and the community wants at this point.
Anything else? We didn't want to have this drag on too long, but
Andy?
yes.
I'm going to throw one out there because this was challenged to the board many, many different times. The question came out at multiple meetings for preference of transport to hospitals. And I believe most folks here were questioning, does Ludlow transport to Rutland, or is it strictly Springfield?
No, we transport to Rutland as well. Most patients that we are picking up currently in Mount Holly do go to Rutland. We do have to follow the Vermont state protocols, which Mount Holly Rescue has been following as well. They're the same protocols, and that does dictate that a patient has to go to the closest appropriate facility. So in Mount Holly, typically that is going to be Rutland. If we get requests for like Dartmouth or UVM, we're not able to do those, but that's the same situation that you're in currently with Mount Holly Rescue.
Yes.
Hi, Steve Hazelton. Stephanie, could you do us a favor and just explain Ludlow's staffing and how it will flex with ski season?
Okay.
Thanks.
So we are fully staffed. We have 2 people on 24/7, 365. In the winter and holiday weeks, and this started last year that we started doing this, we obviously have an increase in call volume. So for every holiday week, starting in November, every holiday week and weekend, we staff 4 people on the weekends, 3 during the holiday week, with 1 person on call. So we have already discussed with the increased calls, we're projecting that we'll have about 150 more calls with the Mount Holly increase, that we're probably going to have to go up to the 3 people during the day most of the time.
Paramedic level?
We strive for paramedic level 24/7, 365. There are occasions with vacations and sick times that we have only at the AEMT level, but I think in the last year we have only had a BLS truck maybe once or twice. Basic
I'm
life
sorry,
support.
Liz, can you, so we can all hear and understand you.
Liz Carl, hi. What was BLS? Sorry.
BLS is basic life support. So there's BLS and there's ALS. Like I said, we strive to have a paramedic on shift every single day. We currently have 4 paramedics, and like I said, the full-time people, they do 2 24-hour shifts a week. So when they're not on shift, we do have 1 paramedic that is also on call at home and does respond from home for paramedic level intercepts as well.
I have questions, so I'm going to stay. Sorry, I'm the town treasurer too, so I have money questions, but I'll start with my ambulance questions. How many towns do you currently serve outside of Ludlow?
So we do Ludlow, Cavendish, Proctorsville, and then we cover Plymouth up to Route 100A.
Okay. And is that from, a lot of those locales are just as far away as the edges of Mount Holly, correct?
Yeah.
Okay. I know that was something I heard come up too, is just distance. I happened to see a plan that was done, like a revision and a review of the ambulance service from 2019. Are there areas from that plan, because that was 4 years ago, that are still in process or things you're putting into place? Or have you really?
We had a consulting firm come, and I think that's the one you're referencing, back in
Yeah.
2019. It was done by Municipal Resources, Inc., and I believe the only suggestion that we haven't done with that plan is they suggested that we're at 6 full-time people, and we're currently at 5.
Okay, thank you, that's helpful. Now, money questions. Is there room to, I know the current contract that was discussed was a per-month rate. It sounds like the prorating question, though, was assuming we would pay a lump sum for the year. Is that up for discussion? Is there?
Our other contracted towns, they pay quarterly, so
Okay.
that's,
There's
I mean,
flexibility
we're
in
pretty
them.
flexible with that, yeah.
Okay, yeah, I wasn't sure from a cash flow perspective where that would land, but we are a 1 per year tax collecting town. So that just plays a role in how we can fund things going forward.
And I think, Mark and I have spoken pretty openly about options that the town would have. And, from my perspective, and without speaking on behalf of the Ludlow Select Board, but, and having conversations with them, knowing that, we're neighbors. This is a unique situation where obviously we're going to try and, I'm, not going to just leave and say, tough luck. We strive to put a good product out, but mainly we want to take care of our neighbors and, our friends and family. So really with your question, payments and prorating, that's something that can be worked out where it's, if all of a sudden we go from November 1 to June 30th and we both look at each other and say, hey, this doesn't work, and we go a different way, so be it. We got through one of the most difficult times of the year. So that's just kind of, my PSA, I guess, from a financial standpoint for the town.
Yes.
Again, I know another question that has been floating around the town, especially during the ski seasons, the heightened calls that you folks get. Do you have ambulance enough to cover your call rates?
So we have a staff of 22 right now. 5 of them are full-time. Like I said, we do increase, so we go from 1 staffed ambulance to 2 staffed ambulances when we know that the calls are going to be increasing. Now, that's not to say that there's not a Thursday in July where we have 4 calls come in at once, because you can't predict these things. So those do happen. In the last year, we've had mutual aid come in 10 times. With that being said, we've given mutual aid 42 times. So we do have mutual aid ambulances come in on occasion, I won't lie to you. Our numbers I'm pretty confident in. I mean, 10 times in a year isn't horrible. I think with the staffing, it is something that we'll be able to cover. We're also increasing, before we've even had this discussion with your town, we have already decided that we are going to increase our fleet of ambulances up to 3 starting next year. So we have an ambulance on order right now. We just got a brand new ambulance that was delivered in May. We ordered the next new one in June of this year. We're expecting to take delivery of that probably at the end of next year. There's just a big lag time with buying product right now. But with that coming in, we're going to be up to 3 ambulances instead of 2.
And we do have I'm sure Stephanie will back me up on this, with our mutual aid response, our relationships with local ambulances, towns, so mutual aid response is very good. If we have to have that done, our relationships are positive. And did you mention the VFERS?
Yes, so we have, in the last couple of years, we've increased our staff, obviously, but we started a contract with Okemo last year where we can share personnel with Okemo Ski Patrol, where we've cross-trained a lot of ski patrollers to work on the ambulance as well. So when we have the call increase from the mountain, we can triage the mountain calls in place. We can have them stay in place and be treated on scene until we're available. And we can also pull ski patrollers to help with our staffing in times of need.
Looking at the agenda, I see that item C is questions Q&A for LAS, which I assume is Ludlow Ambulance Service. Without objection, I think we can move item C, consider that now, which I think we've been doing anyway. If there are any additional questions for Ludlow Ambulance Service or any additional questions in general from the floor, I think we can go ahead with that now. Yes.
Hi, Bob Herbst. Just wondering if there's any plan to liquidate Mount Holly's ambulances and equipment to help defray some of these costs?
We did discuss that. I actually discussed that with Brendan, that, during the height of the season, there's potentials that Mount Holly ambulance could be utilized as well. But we haven't reached out firmly for the liquidation of the ambulance at this point in time.
Thank you.
Yes.
Phil Crane. I'm not clear what the $88,000 buys us. And is that all that we are obliged to pay for this service? Or whatever we're getting for it?
That's a contract value per 911 addresses, and that guarantees us that Ludlow will serve to support Mount Holly during emergency calls.
And is that all that we have to pay?
At this point in time, that is the contract prices, yes.
Okay. So
Yeah.
nothing else, right?
Can I?
Yeah, go ahead.
So the $88,000, you can think of it as kind of a standby cost. So we are saying that you're our primary town in our coverage area. So that's what your $88,000 gets us, because we're staffed 24/7, 365. We have to keep those people in the building prepared to respond at all times. So in addition to that cost, we do also bill the patients when they call 911. So that would be sent, if you have medical insurance, then your medical insurance is going to get billed. If you don't have medical insurance, then the bill goes as a private pay that you would also receive. Now, we do offer a subscription program to all of our primary coverage area communities. So basically, our subscription service is a third-party insurance. Think of it as like your Aflac. So we charge that $60 per household if everyone in the household is insured, and that covers any time that you have an ambulance come to your house. We do still bill your insurance, but if you have a copay, if you have a deductible, if your insurance doesn't cover it, it would be written off. Now, I say this to everyone, we're human, we make mistakes. If you are part of our subscription program and you still get a bill, just call us. We'll take care of it. It's nothing to stress about. Like, mistakes happen. We have a lot of people on the list. It does happen a couple times a year. Just give us a call. If you're not insured, the cost is $120 per household. So still affordable. We can still cover it.
Hi, I'm Diane Deegan. I have a couple of questions. One to tag on to that. Does your service meet the Medicare requirements?
Yeah.
Okay, and then my second was, is there any expectation on response time? Because time saves lives.
You are right. I actually didn't pull that number. But
That's all right.
our response times when we were in the station, we're not too far away. We're right down the road. I know as a service whole, our response, so our call to response is about a minute to 2 minutes. Sometimes at night we go up to 3 minutes. Calls to scene and just as a service, like not specific to towns, it's about 7 minutes.
Okay. And last question, are you prepared to handle the new things that are coming out in terms of healthcare, like hospital in the home, which is going to be a big push coming up?
Yeah, so we do a lot of things in the community already. So the nursing home that is in town, we'll do blood pressure checks, we'll do blood sugar checks. We've helped with all of that stuff as well. We are looking at the, the word is not coming to me, but it's basically sending paramedics out into the community and doing a community health type of screening. We are looking at that stuff right now. I don't have a time frame on when it would happen. It's something that we're prepared for, but right now we're focused on our 911 responses.
Well, hospital to the home is geared more towards taking people that are currently in the hospital and moving them back to the home, because with COVID we found that it's significantly healthier for certain chronic conditions to stay home instead of going into the hospital, and that's what I'm talking about. And with technology now and systems computer generated, you can do a lot of the nursing tasks within the home, utilizing home health, but you can't do that without a backup of a good EMS service. So that's kind of where I'm going with that, because that is going to happen.
Yeah, and I mean, that sounds like a great program. We're ready for all the changes. We keep up with current studies and try to stay on top of everything, having up-to-date equipment and on replacement plans and being kind of proactive.
Okay, thanks.
And one thing I'll say, I'll kind of piggyback on top of this is, I've been in Ludlow for, I said, just about 7-8 months at this point. Previously, I was the town manager in Cavendish for 7-8 years. And coming here and seeing what Stephanie has done as a chief of the ambulance service here is kind of to what you were saying is she does a very good job of looking at what's coming down the road. This area, as we know, is growing, it's evolving, and we have to put ourselves in a position to be able to adapt and react to things that are happening in our areas. Being at the base of Okemo, we know that things are much different this year even than they were last year. Population, technology. So Stephanie does a great job leading that squad and being ready to deal with these things. We've had conversations, not necessarily about the hospital and the home, but different things that we're going to have to look at that are 3, 6, 12 months out, that are not only going to be a challenge to meet staffing-wise with some things, but financially as well. So she has a very, very good grip on those things, and I try to pat her on the back when I can.
We've got a couple people coming up. Jim, Jim, you're closer to the mic, but ladies first.
So I just want to make sure that I understand the billing portion of this. So the town will pay the $88,000, and then you will bill the patient's insurance, and then people can also enroll in the program to also pay. Isn't that double dipping a little bit if we're already paying for your service and then you're going to bill the insurance again?
The service that you're paying for is more, like I said, of that standby fee. It's pretty common in ambulance services because we have to staff for situations that we can't predict. So we can't say like, okay, we're going to put people on Monday at 8 a.m. till 3 a.m. All of the ambulance calls have to go there. So we have to staff for a larger time frame than what we're utilized for. So it's basically saying that, no, we're committed to your town, we're committed to covering it, we're not going to go and take transfers at the hospital that we know are guaranteed payment and leave a town uncovered. We want you to know that we're here to serve your community.
Okay, thanks.
Jim.
I'm James Heald. My question, I guess, is the 911 now goes to state, correct? 911 come next month goes where? Your dispatch or?
Nope, the 911 will still go to the state dispatch, and then your state dispatch will go to the surrounding dispatch center that handles your ambulance service.
Okay, thank you.
Yes. He beat you to it. You're next.
Dennis Devereaux. So our town invested in defibrillators over the last few months, and we've been receiving training. And the instructor today told us that those AEDs would probably be registered with the state, so you guys would know. Does Ludlow have a lot of defibrillators around town, or?
So Ludlow was actually, I think about 4 or 5 years ago, was recognized as a heart-safe community for the state of Vermont. So we're one of only, at the time, 10 towns in the state that were considered a heart-safe community. So that means that the ambulance service is ready to respond to all emergencies. We have an appropriate amount of AEDs per capita. We have the police that carry the AEDs as well that are also trained, plus the fire department. So we're pretty proud of that recognition because only about 10 towns in the state have done it, and we're fortunate enough to be one.
Right. So we, during the discussion, we realized that almost all those buildings with AEDs in them are locked up when they're not in use for meetings or the museum's not open or something. That with the sign on the window, there's a good chance that somebody in a hurry to help somebody would probably break in, open the door somehow to get access to that AED. And she wasn't quite sure how to handle that one, and we don't either, but we know lives need to be saved.
Right.
Thank you.
We had someone in the back. You ready?
Hi, my name is Julie Parcells, and I have a question as far as a response of the Ludlow ambulance with the Mount Holly Volunteer Fire Department. Will that be an automatic?
That would have to be up for discussion with the fire department. Where a lot of towns that we cover, they have first response services with their fire departments, and we would definitely be open to working with the fire department to obtain that certification. We have been kind of an integral part in that. In the last couple of years, we have helped Cavendish Fire Department become a non-transporting first response service. We've helped Proctorsville Fire Department become a non-transporting first response service. And we have helped Okemo Ski Patrol to also obtain that certification. So that certification and licensure, it brings more providers to the area. When you start regionalizing an ambulance service, you're putting the assets kind of in the middle of it. And if you have these first response organizations, they can go and be at the call faster, perform life-saving care quicker while your ambulance service gets there. So we're hoping that that kind of catches on, and would love to help Mount Holly Fire achieve that.
As far as the first responders for what? The ambulance here in Mount Holly?
So
It's
a lot
kind
of,
you know,
a lot of fire departments are also cross-trained in medical response. So I'm not familiar with the protocols that your fire department has. A lot of them have, like, if there's CPR in progress, the fire department's automatically toned. I'm not sure of the protocols that are in place currently, but it's something that I think we should talk about.
okay, thank you.
Any more discussion? Any more questions? Steve?
If you pick up somebody...
You mention your name, please.
Stephen Michelle. If you pick up somebody in Mount Holly, which hospital will you go to automatically, or would you go to Rutland? Because that would be closer than Springfield.
So the protocols say we have to take the person to the closest appropriate facility. There is some discretion. So if you're stable and you're in Mount Holly and your doctors are in Springfield, that's an option. Basically, it comes down to the crew discretion after the closest appropriate facility. I will say we don't go as far as Dartmouth. We try to have our patients go to Springfield or Rutland. It's usually one of the two. Sometimes when you get in the far stretches of Cavendish, Mount Escutney might be a little bit closer, but I would say a quarter of our patients currently go to Rutland, probably 3/4 go to Springfield.
Anything else?
I just had a quick clarification. You had said normally you have, I think, 3 paramedics on staff, 4 on the weekends with 1 on call. Did I get that right?
Just EMS providers.
Okay.
So we try to staff a paramedic every day. but we at least staff at the ALS level.
Okay, great. Thank you.
Yes.
Amy Turco, I have one more question. It's kind of out of the box, but during the ski season, we know how busy Ludlow is. Would you guys entertain using, if you guys approve it, using the rescue building down here and have an ambulance here? So if there is a call up here or on the upper side of Ludlow, the response time is a lot better than going through town.
I don't have an answer to that because we haven't talked about it, but it's something to talk about for sure.
So we do have one more lettered item on the agenda, which we can move to, but we want to keep the floor open if anybody has any additional questions or comments. Yes, back there.
My name is Katie. You mentioned being proactive, and I was wondering if you gather household information with individuals with pre-existing health concerns.
We don't at the time have a database to store that, so we use the state reporting system. It's called Siren, and that information, so if we have a patient that we pick up multiple times, their information is stored in that system, but at the time we don't have a system that would just give us like pre-existing conditions per address. We do work with our current fire departments that we have, and we would absolutely be willing to do this with Mount Holly, where we have a list of all of the fire department members, any pre-existing conditions that they have, plus their resting vital signs and their vital signs that are on exertion. So if we do provide like a standby for a structure fire and we do rehab for the firefighters, we know anything about them that could be pertinent. If they have high blood pressure, if they are diabetic, any surgeries or medications that might affect them when they're exerting themselves. So kind of, not really your answer, but we do have something similar.
Definitely not my answer. Okay.
And I would say too, to kind of maybe help with that answer as well, is that I know we do with Cavendish, and if we were to move forward with the, contracted services here, for example, with the flood, when that flood happened, we ended up staffing an ambulance at the Proctorsville Fire Station because obviously we were going to be cut off from a community that we were serving. That is a piece of it, and kind of to touch on what you said, your question was about the population. A piece of that is every town has an emergency management plan, which part of it targets vulnerable population and vulnerable population segments in that town. If we were to have this service, we would work, our EMS director would work in coordination with yours, so we would have those targeted populations if we need, in the event, when we have another situation like we did. That is a piece of it.
Hey there, Dave Venner. What are the options, if any, if we did not go with Ludlow?
At this point in time, we reached out to regional as well. Regional cannot cover us, flat out. Told us they'll support in mutual aid when they can. We did not reach out to Wallingford. This was one of the quickest options because we were talking about prior to this, before rescue dissolved. And at this point, we can reach out to Wallingford. I'm not sure if they're willing to even do that. But first of all, and most important, is not to leave the town of Mount Holly without coverage.
Understood.
We need to make sure we support our town folks to the best of our ability.
Under the present conditions, are we paying Ludlow anything now?
No, we have no contract at this point in time.
Very good. Thank you.
Yes, another question.
James Rasp. You mentioned the areas you serve today. Do you have any discussions with additional areas you might pick up where you could become even thinner?
We do not.
Okay, thank you.
James, what's your last name?
Rasp, R-A-S-P?
SP.
Yeah.
Looking for another hand. Okay, not seeing another hand, that would take us to item B, which I believe would come back to you, Mark, and Diana.
Yeah, that's the consideration and or approval of Ludlow Ambulance Service contract. Did we reached out?
So Brendan.
So we had gone back and forth. That's still sitting with our attorney. We'll probably have it back, addressing some of the things that we had talked about, pretty boilerplate stuff. I reached out to VLCT, which is Vermont Leagues of Cities and Towns. Again, nothing, they said everything seemed to be fine, nothing out of the ordinary. So I will talk to town council tomorrow and probably get something Monday or Tuesday to you.
That would be great. And as I said, before any contract is decided, we will have our attorney look at it as well. And I want to bring it to the fire department as well, so we can go through that and make sure our fire department is on board with the contract. So until we have the new contract, we're not going to make a motion to accept it at this time. Once we see the contract, then we'll move forward. I'll meet with Ludlow, the board will meet, and we'll make that decision at that point in time. But remember, as the Town of Mount Holly Board, our biggest concern is not to lapse coverage to support the people of this town.
If there are no other questions or comments, I guess it would be up to Mark and Diana to look for a motion among the two of you to adjourn.
Make the motion that we adjourn the meeting.
I'll second it. Meeting adjourned. And again, thank you for all coming out and asking the questions. I also want to thank Brendan and Stephanie for coming and supporting it during this time frame.